Good day, everybody. I'm Dr. Darrell Wolfe, and welcome to Doc Talk Productions. And today, our webinar is called Pain Free, Live Free. Now, that's really quite a big statement because to actually think you're going to be pain free and live free, then you'd really have to know how to create the perfect day on an emotional and physical level. Now, the only way you're going to do that isn't going to be through TV, radio, newspaper, or through your family. It's actually going to come by you being a detective to do your research, because you're not going to find it out in the majority, or the media is not going to give it to you. And it's not going to be the latest, greatest, great nutritional supplement, or the latest, greatest cleanse, or the latest, greatest breakthrough in natural health, or even medicine. There's only one breakthrough that you can have, and that breakthrough will be when you become the master of your body, the master of your day, when you can actually put a little mini you on your shoulder and you can go, okay, so am I in alignment or out of alignment? And you'll always know if you're in alignment because you'll feel joy. And as I've said before, there's actually been studies done, and the majority of the population experiences joy 2% of the day. The rest of the day, they're not experiencing joy. They're experiencing some type of negative emotion, because guess what? It may not be negative to the point that they're crying or they're fearing their life, but there's no such thing as neutral. You're either evolving or you're not evolving. And we actually came down here to evolve. So to actually become the master of your body, you're going to have to decide that it's going to be your passion, your purpose, and your new hobby. It's not good enough to go out spouting off different things and the latest, greatest thing, like I just said. You have to become it. So that's why at the Doc of Detox, we always look at things on an emotional and a physical level. Okay? Let us move on, though. All right. So before we do move on, I'm going to go through the specials. If you want to order any FiberClear, which FiberClear is a systemic combination of enzymes to help to actually bring down inflammation, scar tissue, get rid of trapped protein particles, pain in your joints, things such as arthritis. Okay, so you can take a look on our website if you want more information on that, or feel free to call us at the clinic. We love phone calls. You can't call too often, and we will never cut you short. Okay? Now, the next thing is the curcumin cayenne, that's one of our real flagship products. And curcumin cayenne, as you all know, curcumin is one of the best products to up the immune system, bring down inflammation, but it's also it's the product that's used more than any other product when it comes to cancer treatment, and also when it comes to prevention of cancer. All right? The next one is HCl. As far as I'm concerned, anybody that's bloated, anybody that has indigestion problems, burping, gas, low back pain, nausea after eating, you feel like you want to fall asleep after you eat, we know that your hydrochloric acid in your stomach isn't performing that good. As I stated in another webinar, I'm blood type A. And blood type A, we're vegetarian metabolism. And we're blood type O, they're like back from the cave days. So only in their blood, that is. Now, so a blood type O can basically digest almost anything going. Where blood type A, we're vegetarian more like. So, and when I was younger, I did a lot of things I probably shouldn't have done. And if I eat something like any type of protein, any type of animal protein, or anything that's cooked, and I don't combine properly, or I go to the restaurant, I always take HCl. Take 3 of those and then tell me how you feel. You'll feel amazing. How would you like to feel like your food is digested? You don't want to waste your money. And you're not just wasting your money, but you're wasting your life, because if your food doesn't digest, then it putrefies and it rots within your intestines. And then that's how we set ourselves up for autoimmune disease. And then you've got 22 feet in your small intestine and 7 feet in your large intestine. So that's a heck of a long highway with a lot of bumps and trenches that you're probably going to fall into. Okay? So Also, the L-glutamine, our L-glutamine product, that's for really helping the small intestine, reducing inflammation, helping repair. Because as I stated before, you only have one cell thick in your small intestine that decides what should go in as nutrition and what shouldn't. And if you do things like refined carbs, if you drink alcohol, or if you're the type of person that is emotionally up and down all the time, then you're triggering your brain to dump cortisol and adrenaline hormones, and then you fire up a lot of acidity. Like, you know, people who don't know how to balance their emotions will end up with ulceration and with pain, especially around the sternum region. Okay? All right, so, and if you buy any of those products, you get 2 weeks free of the daily cleansing tea. So if you ever wanted to try it, or if you want somebody in your family to try it. All right, and that's valid until June 14th, all right? Okay. So the clicker's not working, so bear with us. Okay. All right, so today it's all about, we're talking about pain, okay? And I want to read the definition of pain because, first of all, understand something. If you watched the last webinar, pain is either your friend or foe. If you run from it, you're always going to be in it. And believe it or not, to actually live on this planet, pain is actually our most powerful GPS that teaches us if we're evolving or if we're not evolving. You'll know if you're not evolving and if you're not growing and if you're not improving, because you're going to be in pain a lot, a hell of a lot. And if you are evolving, then you know you're not going to be in pain a lot, because when I sense a little bit of pain, that's a warning signal that I need to just calm down, breathe in 5 seconds, breathe out 5 seconds, okay? Put my hand over my heart, both of them, or just keep it there for a few minutes as you're breathing in and out. Align first, okay? Because that's the main thing that we can ever do. And you'll see that you'll reduce your pain right away. Because like I said before, minimum 85% of all pain is emotional, okay? All right? Okay, so let's read Webster Dictionary definition. The physical feeling caused by disease, injury, or something that hurts the body. Mental or emotional suffering. So you can see that even Webster recognizes that pain can be caused from emotional suffering. But understand that the mental or emotional suffering causes the physical suffering, right? So sadness caused by some emotional or mental problem, right? Someone or something that causes trouble or makes you feel annoyed or angry. So we will feel pain if this is their definition. We will feel pain if somebody annoys us. That's not true. You will feel pain if somebody annoys you if you are not emotionally balanced. Because if that means that you're going to feel pain every time somebody annoys you, then you're always living in pain, because people get annoyed pretty easy. So I'm not going to get annoyed. I'm not going to allow myself to go into pain. So that's why I'm saying that you really got to watch your emotions. And when you get angry, well, that's the whole thing too. We actually believe that getting angry is actually a normal process of living here. Actually, it isn't. I can actually talk to you like this and say, would you please not do that again? This is not the type of relationship that I want with you. I want a loving relationship with you. And if we can't have that, then I don't want any relationship at all, because I'm going to honor myself. I'm going to love myself. Now, that's a lot better than getting angry, because remember something, every time you get angry, okay, that goes to your mind, and that when you get angry, that's a negative emotion. That releases negative chemicals. Those negative chemicals set you up for inflammation. That's right. They create the inflammation, which then causes the pain, which then causes the scar tissue formation that people don't even recognize. And we'll get into that in a minute. Okay? So let's look at the medical definition. An unpleasant sensation that can range from mild to localized discomfort to agony. Pain has both physical and emotional components. That's true. The physical part of the pain results from nerve stimulation. That's absolutely true. So what happens is that when you have a negative emotion or you're not able to process an emotion properly, that triggers the nerve pain. And the nerve pain is triggered by the chemical release. So once you understand that when you're happy, you release happy hormones. When you're not happy, you don't release happy hormones and chemicals. You release, what do you release? You release angry ones, all right? The physical part of pain results from nerve stimulation, and we know that that's triggered by a chemical. That chemical is triggered by the emotion that you decide to have. So if you have a very positive one, you release healing chemicals. If you don't, you release destructive. The word pain comes from the Latin poena, meaning a fine, a penalty. Okay, so pain is a GPS. So it is not a fine or a penalty. You are never going to get away from pain on this planet unless you leave this planet. But the amount of pain, it'll be nothing. It'll be just like, ooh, got that. Ooh, got that. But you're not going to get that because you're not supposed to get that. Because if you got that, then you would collapse the whole corporate system of drugs, of surgery, of radiation, of chemotherapy. So, and also, did you ever notice when you are not balanced properly, you pick the wrong foods to eat because you pick the foods that are negative because you're feeling negative. So, and then we do negative things, we say negative things, and you know, when you don't even know that you are actually torturing your family. You believe you're the only one that gets tortured, but you're actually torturing your family whenever you're feeling tortured. Because what happens to you happens to everybody. Because we know that all our hearts are connected. All right? Okay. So, Mark, if you can change the slides for me, that would be great. Okay? So that I don't have to stand here and do it. No, not with the clicker. You would do it with the, can you do it with that? With the computer. Okay? So sorry that the clicker's broke. We'll get a new clicker. You know, that's the whole thing, right? So this is what I always say. If man makes it, it's going to break, right? And then the other thing I say is, guess what? You forgot that you are the greatest healing machine that was ever created in the universe. Did you know that we forget that we heal? We forget that we're supposed to be in charge of our bodies, right? So what I say is this. God doesn't make junk. You're a self-healing machine. So the answers lie within, okay, not without. All right. Down and out and in a coma. So we know that if we pile it up physically and emotionally, that we are actually joining the herd, okay? Now, what do I mean by joining the herd? Well, the thing is that people that actually have taken courses like our whole life coaching course or Braveheart course or have taken our deep tissue course, you know, we have people that come from professional ranges to just, not just, but lay people all around the world because they go, wow, you know what? The course is only going to be 2 weeks long and I can walk away with everything that I need to get started so that I can take my life back, so that I can master it. I mean, these guys aren't mastering their life. Their life is being mastered by their abdominal situation, which is their core. And you got to remember that 80% of your immune system is in your large intestine. And this guy, guess what? 80 to 90% of the bacteria, that because it's bacteria that actually talk to your brain and tell your brain what to do. For every 9 messages that go up, only 1 message comes down. Okay? So they give 9 messages to the brain. And remember something, your good bacteria turn bad. When you have bad bacteria, you have bad dreams, you have bad moods. Oh, that's just Jimmy. He's in a mood. No, he's not. He's constipated. All right? He's constipated and he's grumpy and he's toxic. And you know what? He's not going to be in a mood. It's a behavior problem. It's a behavioral problem that's created because of a diet problem. But here's the real truth. Jimmy has never been taught how to love himself. So, you know, here's how this works. Until you are self-aware, you never have self-realization on what your value is. But you can't have self-realization until you start learning about self-love. Now you're going to tell me, well, I love myself. Well, by the time that people get into the second day of our courses or into Braveheart, our online training, the first day, they actually realize that they've never loved themselves, that they've been filling their tank up with their family, but this guy's been filling the wrong tank. Instead of filling his heart, he's filling his what? His core, because this abdomen is at the same level of love he has for himself. And believe it or not, the majority of the population are trying to actually kill themselves. Next slide, please. Okay, so the large intestine has between 2 to 6 pounds of microbes. Those microbes that keep getting attacked by you with alcohol or over-the-counter drugs, prescription drugs, street drugs, or the drugs and chemicals that are in the processed foods are destroying these little critters in the way that they're mutating them. You know, when they talk about, oh, well, there's a new virus, there's a new bacteria, there's a new fungal problem. Well, that's because every time we add new chemicals and new things to the environment, that creates a mutation, and that mutation becomes us. So then they go, oh, now we have to go fight this new virus or this new bacteria. So now we have to defend ourselves from our environment. And the only way you're going to defend yourself is by filling up your heart with love, processing properly your emotions, and monitoring what goes in your mouth. And remember something, don't trust anybody. Unless you're buying from the farmer, don't trust what things say, because they're going to continually use different names and hide the chemicals within chemicals and within foods. That's the name of the game. Okay, next slide, please. All right, when our mind is overwhelmed, we overreact equals chaos. When the body is overwhelmed, it overreacts, equal pain and inflammation and scar tissue formation. So this is what I'd like to say. There are so many fabulous therapies that you can get in the health field, but every one of them, unless they're going after the scar tissue, I'm telling you this, you might think this is just my personal opinion, because sometimes I feel like I'm the only guy saying it. And every therapy has its place, but until you learn how to stop producing scar tissue in your body, until you learn how to reverse the scar tissue you already have, I'm going to show you what happens. Next slide, please. All right. Emotional issues in your tissues. All right. Now, negative emotions release negative chemicals, like I was telling you. So if you continually are in fight or flight, then you know how people say, I'm going to fight this cancer. I'm going to battle this cancer. Well, remember something. Don't you think that is a negative emotion? I'm going to fight this disease. We don't want to. Let's love ourselves well. So positive emotions release positive chemicals. We know that. You know, there's studies of people that just watch funny movies and they heal. There's people that actually go and they move away from the city, or they quit their job and their disease goes away because they hated their job. Or there's people that are actually in relationships and they're actually getting diseased because the relationship is diseased. Well, what do you do when you want to change and your partner doesn't? So when we have a lot of negative emotions, we're going to have a lot of negative chemicals, and it's those chemicals that are actually going to bring us down. Next. We just jumped. Can we go back, please? Okay, so here's the deal. Infection, right? Now, infection, what are we talking about? The infection could be negative emotions. It could actually be long-term inflammation that causes rotting of tissue that causes infection, or it could be inflammation that's causing excess mucus. That can create infection too, that houses bacteria, fungus, parasites, you name it. So infection, okay, equals inflammation, which equals scar tissue. Scar tissue is there to wall off in the cases of your intestine, leaky gut. It's to wall off pain and inflammation so it doesn't spread throughout your body. All I'm going to say before I finish this is, what are you going to do after the disease is gone or you start feeling healthier but you still feel stiff? Do you know that if you've been sick for a year, 2 years or more, what are you going to do with all that scar tissue that's in there? Yeah, I feel better, but I just don't feel like myself. Well, because if we actually learned how to get rid of the internal scar tissue, we would totally renew our bodies. Now, I want to know why we're not focused on that. And what I feel sometimes my mission is to get the word out. Because even muscle therapists, like, they say, oh, I'm a deep tissue muscle therapist. Like, with my course, it's Wolfe Deep Tissue Certification when people come here. But in actuality, it should be called Wolfe Deep Deep Tissue Joint Therapy, because where most scar tissue is, it's in your joints. That's why you're right, or it's in around where your organs are, like fibroids. You'll find the pelvic area to be loaded with fibroids with anybody over the age of 40 usually, or you'll find women to be loaded with fibroids around the breast area. Okay, or you'll find in any type of disease, any type of organ, you're going to find scar tissue. Ask doctors who do surgery, and they will tell you this. And they'll also find that wherever there's a diseased tissue, there'll be scar tissue, and there's usually worms too. Okay? And in fibroids, you'll find worms in fibroids. They're like a fibroid nest. All right? Okay, so scar tissue will wall off pain and inflammation. It'll also stop the inflammation from spreading, okay? So it'll stop the destruction of healthy tissue, because inflammation over time is actually destroying your tissue. It's decomposing. And when you get decomposing tissue, you're actually poisoning yourself because your tissue's rotting, okay? I know it's not the nicest thing, but you need to understand something. That's why people that are older and they're really sick, they don't smell that great, right? Some people smell like pepperoni, and that pepperoni smell is also fungus, and it's also tissue decaying. And I know this isn't the greatest topic in the world, but understand something. You shouldn't be smelling under your armpits. Your bowel movements shouldn't stink and have the wallpaper peeling off the bathroom, right? And your groin shouldn't be smelling. We should not be having smells come from our body. Just like when you roll over and you go, hi, honey, and she goes, oh, no, please go brush your teeth. All right? It smells like somebody went to the washroom in your mouth just before you woke up, right? So that's hot air rising. And of course, hot air rises all night while you sleep. Because you're sitting there, you're not moving. The hot air rises because you're breathing. But here's the problem. How long has the waste been in here? How much bad bacteria is in here farting? Oh yeah? Bad bacteria fart. They do. And you also, the rotting of your waste inside of you. Did you ever see a manure pile? If you take a pitchfork and you flip over the manure, you'll see all this gas come off of it. Well, that's you. So if you don't have proper transit time and you don't have enough good guys in there and you got bad guys, well, bad guys make a mess, don't they? They're called terrorists. Well, they're terrorizing your intestines. All right, so let's keep going. So also to wall off parasitical attack, because guess what? Okay, so do you ever watch those Africa movies where there's a herd moving along and then you see that, let's say a zebra, and he injured himself and he's limping? Well, guess who gets eaten? Okay, so predators will attack the weak, the prey. So wherever your weakest tissue is in your body, that's where the parasites go, the bacteria goes, the fungus goes. So it's an attack. And I know that I do repeat things. I try to make things different for you, but you have to understand something. It's not complicated. It's really simple. But we've made it complicated. Even in the natural health field, we've made it complicated. Okay, so we want to wall off and slow down cancer cells. So that's what happens, and I'll show you in a few minutes about that. And of course, deaden the pain. Now, here's what happens. Remember what I told you, that your emotions, if it's negative, releases toxic chemicals, not healing chemicals, but chemicals that actually tear you apart, like fight or flight chemicals, like adrenaline, cortisol. So what happens is when those get released, they trigger your pain fibers, which is your nerves, and then that creates the pain. Now, what happens if you don't get your emotions under control, or you've got an addictive habit that you like to dramatize that the world's ending, or you've got an alcohol problem, like you wanting a glass of wine every night, and believe it or not, that is an alcohol problem. All right? But I'm not judging, it just is. Now, or you have a cigarette problem, or you have some other type of problem like that, you're going to be in pain all the time. Now, what does that do? That drains the immune system of all its energy. You drain the immune system, you're toast. So your body says, let's make enough scar tissue to deaden the pain. So it chokes off the nerves. Okay, so why do you think people have neuropathy? Neuropathy is caused from scar tissue wrapping around the nerves. And how are you going to get rid of that? Well, we can turn that around within a few days to a few weeks. You can actually turn anything around over time with the right thinking, okay, which is the positive attitude, believing in yourself, remember who created you, and knowing and believing and seeing yourself in that position. Remember something. Are you the type of person that has a health program because you're scared you're going to be sick? Or are you the type of person that has a health program because you're honoring yourself, because you love yourself and you want the best for yourself? Now, whatever you focus on, you're going to get. Okay, next slide, please. Oh, wait, you see the scar tissue here? This is what we'll be talking about. And this is what we do. Here comes the fibrin. The body makes fibrin every time there's inflammation to wall off the pain, to wall off the parasites, to stop the inflammation from spreading, right? To stop the fungus from coming in and attacking. Because what fungus wants to do is come in and attack, and bacteria, and they will bring down the oxygen levels, and they will bring down the circulation and the nutrition, which causes mutation. You see? So, yeah. So anyways, here comes the fibrin, and then after a while, when the fibrin comes, you're going to end up getting a knot. So people actually have knots in their body and massive scar tissue as if they've been in a car accident and they never had an accident. Okay? So what the real accident is, the accident is that they've never been taught how to do better, to break away from the herd before they start to limp so that the predator doesn't eat them. Okay. Next, please. All right. So, muscle pain is the protector. I told you pain is a protector. Okay, scar tissue is the ignorance. Now, when I say scar tissue is the ignorance, I'll tell you why in a minute. Now, if you take a look, okay, let's take a look at, you can get somebody who says, I have so much pain in my bicep, right? Now, why would a person have pain in their bicep? Well, that's because there's scar tissue in the elbow, and the pain in the bicep is like this. So I've got, there's flexion, there's extension. When I extend, I'm stretching everything in here, right? So if I stretch the muscle here, I want to make it longer. If I make it longer, where is the pressure point? The pressure point is at the insertion in the elbow and at the origin in my shoulder. So if I stretch out like this, I make it just 1/8 of an inch, 1/16 of an inch longer. That's long enough to have my muscle go into spasm to protect because of the scar tissue in here or in the shoulder. If I go in here and work here for 5 to 10 minutes or 5 to 10 minutes in here, there's no muscle pain in the bicep. So understand something. 90% of the time, even more, but I'll just say 90. It's not in the muscles. So we don't want to work on muscles. We want to work on joints because that is the stress points. That's where you have less circulation, but that's where all the tears are. Oh, wait a minute here. Let me think now. Oh, carpal tunnel syndrome. Oh, it's in the wrist. Oh, I got to have a hip replacement. Oh, there it's in the hip. Oh, I just ripped my knee out. Oh, it's in the hip. I mean, in the knee. Oh, I got to get operation. I've got frozen shoulder. Oh, there you go. Oh, wait a minute. They have to do surgery because my spine is deteriorating. Well, that's all scar tissue in here. It's always about scar tissue. Even if you got into a car accident, that whiplash you had 20 years ago, there's a big lump of scar tissue in your neck that's causing your pain, shutting down circulation to the vagus nerve, probably blocking off your occiput. So do you want to know where the headaches come from, or where the dull thinking comes from, or the continual just pain in your neck and you can't get rid of it, but you keep on getting an adjustment, or you go get acupuncture? All of these things help, but if we don't focus on the scar tissue, we'll get bit. So muscle pain is the protector. So even if you've got a pain in your calf, or you have it up in the upper part, you've got to look to the hip or the... So if I had a muscle pain here, I would look to the knee and I would look to the ankle. If I had it in the upper part of the leg, I would look to the knee and I would look to the hip. And it's always like that. So how sure I am of this is that we offer a money-back guarantee to people that come here from even around the globe to get treatment. We offer a money-back guarantee for people who take our courses. Now, we do that because the whole scar tissue thing is not out there. And you know what? Right now it's a rumor. But until we repeat it 1,000 times, people don't accept it. Until we have enough people like the herd mentality going, hey, yeah, that's it. Did you ever notice something? All of a sudden, when everybody talks about something, everybody wants to do it. But until then, nobody wants to do it. And I don't know, following the herd hasn't been a really good idea that I've seen in the past. Next slide. Oh, wait, before the next slide. So just understand this, that when you've got pain, you don't actually have bone pain. You've got joint pain in here, okay? So people think they actually have bone pain. The only time you really have bone pain is when you've inflamed by really hitting the bone hard, or if you have bone cancer. That's pretty well the only times. So understand, it's always usually coming from muscle as the reaction, but it's always like 95% of the time, it's protection for the joints because they've been getting tore and there's scar tissue in here. All right? Like just somebody can get a little bit of scar tissue crystallization right in here where the ankle is, and you can't walk properly. I can go in there for 5 minutes and bring that down. So we call this the horseshoe right here at the ankle. And if you work on that for 5 minutes, you'll feel like you have young feet again. How would you like to have a whole young body again? So if it was just a shoulder problem in one treatment, an elbow problem in one treatment, I'm going to turn that around. But anywhere from takes around 20 treatments, and you can actually get rid of all the scar tissue pretty well throughout the whole body, so that you'll have your mobility back, your strength back, your elasticity back. You'll feel young again. Trust me. Do you know why you feel old? It's not your mind. There's people that are 90 years old and they can't move because they're so damn stiff because of all this scar tissue, but they got the mind, a sharp mind, and they've got like a little boy or a little girl in there that want to play still, but they can't play anymore because they were never told about this. Next slide. Inflammation to cancer. So understand something. I'm talking about fibroids. I'm talking about scar tissue. So, you know, what leads up to this in the body? Well, it has to be decreased circulation. It has to be ongoing inflammation. If you didn't have ongoing inflammation and all this scar tissue formation, how in the heck would you have cancer? How would you have it? Okay, let's go to the next slide. Okay, so here's what happens. Okay, it's called the snowball effect. So you start off and you've got scar tissue in your body. That's not so bad, eh? You know, I've got a little bit of scar tissue down here in my pelvic region, or maybe, the woman has it in her breast, right? Because that's where we usually find the fibroids. And then what happens is we don't get proper treatment. What's the proper treatment? Well, I'll tell you what. Give me a fibroid even the size of this. That's an orange. Okay? And in one treatment, I'll break that fibroid up to the point, not only break it up, but pull it apart to allow the blood and the lymph flow back in so that it'll soften it up and return it back to normal tissue. The only reason why you got a fibroid is because you got all this fiber in there and it's compacted. And what you've been doing is this area, let's say it's in your pelvis, is so toxic that you've got scar tissue trying to block off inflammation. But you know what? You didn't get proper treatment. You didn't know you were supposed to do daily cleansing tea every day so that you wouldn't back up all that waste, to reabsorb your waste, to have it go into your groin so that you could inflame your groin, then to have the scar tissue come in, and then gradually, guess what? You roll that, look at that, starts off at a snowball, and it'll just keep growing and growing. When you go to the doctor and you've got a fibroid somewhere, and when it comes to men, you know what? We only talk about it with women. Well, what do you think a bladder problem is? If you've got a bladder problem, are you trying to tell me you got no fibroids down here? Yeah. When I go down in this area and somebody says, you know what, I just feel restricted. You know what, I've never even had a problem down there. And I go down there and we start pulling things apart, you actually hear snap, crackle, pop. It's actually like when you pull things apart, because of the crystallization in the scar tissue, you can hear it. It's not like you're not hurting anybody, and it's not like painful or anything, but you can feel it pulling apart. And then you allow the blood to flow back in so that you can normalize, because oxygen and nutrition, and get rid of the waste, and bingo bango, we're back to where we started. Simple as that. So then the fibroid goes here. But what do you think happens when you have a fibroid? A big fibroid like this, do you think that the circulation's not cut off? Do you think that, okay, so for every layer of scar tissue that you have here is what? Unprocessed emotions and chemicals. So you keep on layer and layer and layer like an onion. And I'm telling you, down in here in the middle of this fibroid, it's as hard as a hard ball, a rock. So what you go in and you start to go around the edges, and you start getting the softer. And as you go around the edges, the blood comes in right away. And if you've got that person breathing 5 seconds in, 5 seconds out, and then pretending more like they're a spectator and just breathing it, and they're visualizing that fibroid coming apart. Listen, do you actually believe you're not powerful? Let's turn this on. Let's get rid of this stuff, okay? So then the fibroid, if it's left, oh, well, here you go there, or you have a lot of scar tissue and the doctors go, well, you know, it's not big enough yet. Oh, well, thanks for that. So we'll just go home, okay? So we'll keep an eye on it for you. Once a year, and then you crap your drawers every time you come in until they go in and say, well, it didn't grow, or it did grow, or now it's mutated. So who likes bingo? I don't want my number being called. So anyway, so now this grows big enough that now they go, yep, it's no problem. We can go in there, we'll do pelvic clearance. We're gonna have to take it all. The ovaries, the uterus, or we're gonna have to take the prostate out, but we'll get it all and you'll be clean. Okay, now how many times have you heard somebody say, we got it all, and they didn't get it all? Because to get it all means that they must have changed your belief systems, they must have changed your eating habits, and they must have made you wake up that you are the greatest healing machine on this planet. I don't know how they did that. Okay, so fibroids to a tumor. Just cut off the oxygen and you'll find out what happens. The domino effect of unprocessed emotions and our healthcare system. All right, next slide, please. Okay, so fibroids to a tumor, the same fibrotic scar tissue found in a sports injury post-surgery. Did you get that? Or any scar tissue caused by a physical or emotional imbalance is the same scar tissue that you would find in a fibroid or a tumor. So when you look at a tumor, that's not all mutated cells. So what I say to people is this. You know, we get people that come in and the tumor is big and they can't get their arm down. They're in pain. They can't sleep anymore. So how is it when they come in and we work under the arm, we work back here, we work up here, we work around the area, and all of a sudden they can have range of motion again. That allows the oxygen nutrition to come in so that they can sleep, and so that we can be more effective at what we're doing, and they can be more effective at what they're doing to help to turn around that situation. Okay, next slide. Okay, so when you are backed up it really is your back that screams at you. So this is the back of somebody, right? You see the large intestine here? So when you get backed up and you think you have kidney problems, guess what? No, you've got a roadblock here, and it's a fecal block. All right? So, and it's right here. And then over here, this is where the cecum, you have your small intestine, then the cecum where the fecal waste starts to climb up here. But most people in the cecum, not most, some, okay, they'll have a whole nest of worms. Because believe it or not, today most people have worms. If you have a disease or you have an illness or you have chronic fatigue, guess what? If you're tired all the time, predators come and get you, don't they? We already talked about that. So if you need to realize that parasites are a problem, fungus is a problem, bacteria is a problem. And at every disease, they all come to the parasite party, right? So the waste will back up here. So now look at, oh, I got hip problems. Well, yeah, I'm sure you do. I've got kidney problems. Oh, I'm sure you do. Oh, I've got spinal problems. Look at it. Isn't this something? So here is where the large intestine is, and most spinal problems happen right here. So don't you think you reabsorb your own waste when it sits there and stagnates long enough? All right, next slide, please. Now, when you do reabsorb all that waste, just remember something. That creates inflammation, causes scar tissue formation. And if you've been backed up, which, you know, if you're not going to the washroom 3 good size movements, slightly on the loose side, every day, then guess what? You're going down the wrong road. There is nothing more important than your large intestine. There's nothing more important than your poop. And doctors do not know poop. Okay? All right. Continuing reoccurring pain is a scar tissue issue. When will practitioners wake up? So how many people here have constant pain in their neck, in their back, in their shoulder? It doesn't really matter. And every time you get stressed out or you don't eat right, don't get your sleep, or you go and you do some kind of physical thing that you used to do but you can't do today, you'll go out for 15 minutes and then you're like, oh, the next morning. And you know what you say? Well, I'm 30 years old, or I'm 40 years old, or I'm 50 years old. That's what people do when they're 50. Well, I'm 61. So you know what? Don't believe it. Don't believe them. Because if you bought into that, that means you bought into drugs. Because now you say, okay, you know, God made junk. God made junk, and junk needs drugs. Because we are so dysfunctional that we can't heal, that we need to numb out the pain. None of this makes any sense to me. Remember, I'm not against the pharmaceuticals. I'm not against the medical doctors. I'm for the people. And I'm for those people that want to get off the couch and get off the drugs, and they want to experience life like they did when they were a young child. You don't have to end up in a nursing home or a wheelchair. You don't have to have a cane. All right, next please. Tell you what we do need is a new clicker. Okay. Mistreated and they dare call it healthcare. So how many people do you know? Oh, I have a little bit of arthritis in my hand. How many people do you know that? Okay. And then there, now she's 75, 80. Right? She started out with just a spasm. Oh, and then, you know, people with hammer toes and their fingers are like this. Guess what? Are you ready for this? We can straighten them and get them to move again. It's not a miracle. It's not amazing. So just remember something. Everything that you think is a miracle, everything that you think is amazing, it was God given and it was man taken away. Okay? All right, next. Grandpa is stiff as a board, frozen shoulder to a hip replacement. It's all about scar tissue. So he gets his cane. Oh, look, now he gets his walker. All right. Oh, wait a minute. Now he's got his wheelchair. Does that sound like anybody you know? And guess what? This can all be reversed. And it doesn't have to happen in the first place. But it will continue to happen because we are corporate America. Next, please. Scarred for life, web of destruction. So in the area of the pelvis is where we're going to see explosions. You're going to see prostate cancer. You're going to see breast cancer. See, the breasts are connected, totally connected to the ovaries and the uterus. Did you know that? So when they get in trouble, there's trouble up here. It's like when you go to the fair and the guy with the big hammer hits down on that thing and it goes up and hits the bell, well, there's the pelvis, there's the ovaries and the uterus or the prostate. But for women, it's the ovaries and the uterus. And the bell, well, the bell, there's the bell. Okay? So you have to understand, because do you remember when you were younger and you would get your period and your breast would hurt? Now tell me that I'm not knowing what I'm saying. This is the reality of it. And they're directly connected because everything is hormonal. My gosh, you have a baby, all of a sudden these things can make milk. This is all about hormones, all about chemicals, all about turning on. This is connected to this, and don't you kid yourself. So if you want this to get better, then you better look at cleaning your colon and getting rid of the fibroids down here so that you can turn on everything that you were meant to be. All right? And you may not be diagnosed with a fibroid, but I guarantee that when we go down there and we start massaging that area and taking those fibers apart, and you start to feel that freedom. Next. Okay, so all I want you to see is here. Here's your bowel. Here's your bladder. Here's your uterus. But most people's bowels have fallen down the transverse colon. So it's actually like something sitting on top of your uterus and your bladder. Okay? And it's choking your uterus and your bladder off. That's why, and what happens when you reabsorb your waste, that's got to go in and usually goes in through your kidneys and down through your bladder. And that waste is really toxic. And the waste actually sits at the bottom here and it stagnates and it inflames your bladder. Your bladder squeezes down. Okay? When it squeezes down, you get a little bit of urine in there and you go, I got to go to the bathroom. And then you go and it's only a couple ounces. You know, I know I pee at least 16 to 24 ounces every time I pee. So that's the difference. And I'm going to be 61. And I'll still be doing that when I'm 80. Because you got to learn how to play the game, the earth game rules, right? And that is that you trust in yourself. Okay? Now, so what happens here is then when the waste, and you get constipated every time, and you're absorbing waste through here, where do you think it's hitting? The ovaries, the uterus, okay? And now you've got the waste in the bladder, and that's irritated. How many people get up at night to pee? And they get up tonight to pee, not once, not twice, not three, not maybe even 4 times. And they get up, it's dark in there, they bang their toe on the way, and they curse a little, and then they get there,
Wait.
a few drops, you know? I mean, that's like pretty depressing. And then you got to go back to bed again. Right? So you can turn this all around. And then here's the deal. So I have people that go, I need you to drink, if you're a woman, 3 quarts of water a day. I'll be peeing all day. And I said, okay. So you get to pee all day because you owe the bank. Because you need to take your bladder, okay, to the gym. You're going to have to exercise your bladder. It never got any exercise before like it should. So then you're going to restore it. But for about 3 months, you're going to pee like crazy. So just if you have to, tell the doctor or get a doctor's note because or something and give that to work and that you have to pee because they can't do anything about that. And then you go and pee 20 times a day and then you call me up and tell me in 3 months how you start seeing your illnesses go away, how you have way more energy and how you're a lot nicer to be around. So that's what that is. And if you're a man of 160, 70 pounds, you better be drinking a gallon a day. And if you weigh close to 200, then you better be drinking about 5 quarts a day. Okay? And in Canada, 5 liters. All right. So same thing with the men. Okay? So this is a prostate sandwich, and that's what you are. Okay? You've got a uteral sandwich, you've got a prostate sandwich, and nobody really cares. Nobody really cares. Who really cares? It's your body. And you're only going to get the care that you show to yourself. So when you embrace self-care, you'll get everything. And you'll have everything back. Because it's your body. Okay? Next slide. Okay. So as I was saying, or I wasn't saying, but I will say now, is that do you ever notice that everybody is kind of putting on weight? Not everybody, but the majority of the population are putting on weight. They can't take it off. The reason why they're putting on weight is because they're toxic. They're eating toxic foods. They don't know how to process their emotions. And when you don't know how to process your emotions, guess where your emotions get processed? They get processed in weakened tissue or in fat tissue. Where does the chemicals get processed? Like the adrenaline and, you ready for this? The adrenaline hormones and the cortisol hormones, you need fat cells to put those in. Because when you don't have fat cells, you wouldn't be alive. So the adrenaline hormones and the cortisol hormones are really acidic. They'll eat you up. And people who live in fight or flight, okay, or people who have heartburn all the time, they'll eat you up. So your body wants to create fat to store it, because if it doesn't, you're creating even more scar tissue, more mutation, heart disease, you name it, strokes. It just goes on and on. So fat tissue is your friend. So I want you to just hug your fat, because if it wasn't for your fat, you wouldn't be here. But as soon as you decide to change the name of the game, meaning bringing in live, fresh and raw foods and honoring yourself and learning how to create the perfect day on an emotional and a physical level, then guess what? You will no longer need to keep the fat cells or the scar tissue. All right? So remember this. What are breasts made out of? Fat. So when a woman is tired, stressed out, fatigued, or she is sick, the body says, I don't have enough energy to make more fat. Oh, wait a minute. We got 2 storage tanks upstairs. Fill it up, boys. Anyways, I think you get the message. Next. So we want to create the perfect day for the perfect life. When you master your day, you will master your life. And that means on a relationship level with yourself first, and then everyone else. Because if you don't have a good relationship with yourself, you can't have a good relationship with anyone else. And if you get a couple that goes and wants to learn and do our Braveheart training, our whole life coaching, and they start working on old belief systems, and then they come together as spiritual beings, not just physical people, to come together to honor each other, to grow, to evolve, and to be able to help each other through this adventure we call Earth, right? Next. Okay, so we want to become a Braveheart, all right? Anyways, these are some of the trainings we do and some of the certifications we do. We're also going to be doing trainings in Mexico, and we're also doing trainings in Ireland. I'll be in Ireland doing what's called Supercharge Your Life for 2 days and 2 lectures on August the 9th, my birthday. So if you want, check my website at itioh.com, and who knows, maybe I'll even get a pot of gold for my birthday. And then I go back there in October for 3 weeks. We're doing our deep tissue training, our whole life coach training, and our non-surgical training. We're doing that also in Mexico around January, the middle of January, 3rd week in January, and we'll have that posted up by September about Mexico. But if you want to check out, and you've got some Irish friends or people from the UK or Europe that want to bop over. So now what I want to do is I want to introduce, we've been doing a deep tissue course, and with our deep tissue course, we teach professionals and we teach people from all walks of life, because health was meant for everyone, okay? And if you ever feel dumb, or if any practitioner is making you feel dumb, then they're not honoring their oath. And the thing is that once you learn that you need to be trained and not treated, then you'll become the master. Helena, would you like to come up and introduce yourself and tell the audience what you've experienced while you were here with the whole life coach training, maybe just a little bit, and then the deep tissue?
Thank you so much. Well, hi everyone. My name is Helena Lazowski, and I am from Mississauga, Ontario, Canada. And I am so honored to be here in the presence of the Dr. Wolfe, and I was participating in the whole life coaching certification program, and this week in the Wolfe deep tissue technique. And especially I am so in awe with the Wolfe deep tissue technique, because I was honored Dr. Wolfe was working on me. On the first day, he was working on my sternum area, which is very often related to our constipation. And it was such a profound experience, because he found scar tissue right here, and the moment, and after a few minutes working on me, the moment he broke the scar tissue, the explosion of energy shoot out through the palm of my hands and through my jaw and then through my head. And this releasing of this energy lasted at least half an hour. And after that, I felt so light like never before. And huge energy of the unprocessed emotion was released. And the next day, I was lucky again. Dr. Wolfe was working on my vertical line in the middle of the between the eyebrows, and he explained that this line is related to unprocessed emotions in the heart specifically. And the moment he broke this scar tissue, it was different experience, but I burst with the tears and lasted for a few minutes, and then after that I just had to breathe so deeply, and I could feel in my body, right in the heart, the last release of the energy. So this was so profound experience, and to feel this connection from the vertical line between the eyebrows to the release of the energy from the heart. So I am so in awe with this technique, and again the course with the whole life coaching. It just this is what Dr. Wolfe is teaching. Love is the answer. Self-love is the cure. And this is so true. And this whole life coaching is all about this. So I am so honored to be in presence of Dr. Wolfe, and I feel so relieved. And now I'm looking forward to assist others to release these emotions and from their body. And it's so incredible, the connections in our body with our emotions. Thank you so much.
Thank you so much.
Thank you.
Very good.
Thank you.
All right, so now I would like to have Stenell come up. And Stenell, you can tell everybody where you're from if you'd like, and what you feel.
Okay.
All right?
Hi, everyone. My name is Stenell Brewer. I'm from Weatherford, Texas. And I have been excited to be here learning the Wolfe Deep Tissue and the emotional course. It's just, well, I'll just tell you, I had an accident when I was younger, so my hips and my legs have given me much trouble. And just learning how to release the scar tissue from my sacrum has been very helpful to me. My hips and legs are now looser, and I'm looking forward to the rest of the treatments that I'll be getting. So we're all working on each other, and just a little bit was amazing. So if you have problems that nobody else seems to be able to help you with, just make it simple. You are the answer. Thank you.
Thank you, Stenell. That was great. Thank you. All right. So now we're going to have Adam come up. Adam, you like to tell your little story?
Love to.
Thanks, buddy.
Thank you. So my name is Adam Strickland. I'm from a small town called Lindsay, just outside of Toronto. I am now a deep tissue therapist working from the Galatea method in Lindsay, back in Ontario. So if you ever need any help, come see me, come see my mom, we'll fix you up. Just want to tell you a little story about while I was here. I had the most incredible little breakthrough experience for myself. I'm working on, so another classmate's SI joint, basic maneuvers, just working around. So the SI joint, yeah, let me tell you what that is first. So the SI joint is basically the eyes of the lower back. Those little dimples that you get on your lower back, that's your SI joint. And you will develop a lot of scar tissue in those areas, and this might be because of a sedentary lifestyle, emotions, nutrition, you name it. Whatever your occupation is, if you're sitting down all day, you're going to develop a lot of scar tissue on those areas. So I'm working on a gentleman for about 10 minutes, I'd say. I find this nice little chunk of scar tissue, and I'm breaking it apart with my elbow, and all of a sudden it just destroyed, it's gone. the next day I ask him how he's feeling, and he has so much more range of motion. He's moving his hips around. He feels just totally free. And that's from a 5-day learning process, 5 to 7 day learning process. And I can't believe that I myself have that power to heal, on top of giving people nutritional protocols, emotional protocols. This is the total package. Come here and learn this, and you have it all. Just thank you for your time, and good luck.
One more, and it's Simon. And just so everybody knows, none of this was rehearsed. Thank you, Adam. But Simon is going to be, he's hosting us in August, like I said, for the Supercharged weekend, and then again for full-fledged training in October in Wexford, Ireland. They actually have palm trees on the beaches there. Can you believe that?
We do.
Yeah.
Thanks, Darrell.
Yeah. All right, my friend.
Thank you. Hi, how you doing? So yes, my name is Simon Cullen. I'm a therapist, whole life deep tissue therapist, and whole life coaching therapist based in Wexford in Ireland. I've been here helping Darrell as a trainer. For the last 2 weeks, we've been taking the students through different techniques, showing them how to get rid of scar tissue, how to help with emotional clearing, and help also with the nutritional stuff. So I'm just going to share a little bit of a story about how I just helped one of the students working on some scar tissue that was in a knee from a surgery that they'd had many years ago. Didn't have full range of movement, so constantly didn't have also contraction in the back of the hamstring. What happens is a lot of the time after people have had surgery, even after they have rehabilitation, they usually go to see a physio for 6 months. They have all the treatments done. They still don't get the full range of motion as they do the opposite knee. So now this person is probably 15 years ago that this person had the treatment operation, and now they've already increased their range of movement by another 40% and actually have now contraction of the hamstring. So if you take it, so someone who's 40 years of age and they're already getting this now, wait for another 10, 20 years and you'll see further decreases, not only just in the physical stuff, but because the nutrition isn't getting into the scar tissue area, it's blocking off all the nutrition, blocking off all the blood supply, in the lymphatic system is also blocked. So also this emotion stored there. So if that hasn't been cleared, this needs to be cleared out. So doing the whole life coaching course, taking on a practitioner who can actually take you through the steps in order for you to be able to see what it is that's blocking you in your life. You know, so I'm here helping Darrell at the moment. He's also coming over to Ireland to give me a hand in October and in August. So if you're around, you know anyone that wants to have some little access to a weekend course that they will open up their thought processes, that can start sparking off some ideas about what they can do at home, how they can help their family, what it is that's challenging them, why they're not being able to complete what they need to complete. So if they think that once you've come to that weekend you want more, then you can also do the trainings in October. We start on the 15th of October, we finish on the 30th of October. It's going to be an amazing thing. You think it's a short time, but so much can get done in that time. I've been here, I've also been working on myself. Even though I'm a trainer, I'm still growing. I'll be coming back, helping more and learning more from students and from myself. So please look up the website. It's a fascinating idea. Thank you.
Thanks, Simon.
Thanks, Darrell.
Appreciate it, buddy.
Darrell Wolfe. We've been friends for a while now.
Anyways, well, we're all friends, and nobody actually calls me Dr. Darrell Wolfe when they're here. Okay, so just know this, that whatever you think about yourself, I want you to multiply it 1,000,000 times, and then you're just scratching the surface. That's the potential that you have. And I'm not talking about coming here to take my courses. I'm talking about go inside, and you remember that little boy, that little girl that you've been trying to hide? Well, you know what? I want you to become an unrealistic dreamer, and I want you to go for your dreams. And when people tell you that that's not going to happen, don't tell anybody. They're your dreams, okay? And only talk to people who will help to bring you up, because that's what it's all about. The world will knock you down if you give it a chance, okay? Because most people are too scared to do anything. So, you know, you going ahead and creating your and making your dreams, people will say that's great, but if they see that you're doing it, they'll just get scared. So, understand who you are. You're amazing. Now, what we're going to do is anybody, if they'd like, they can go on the chat and you can put all your questions in and we will answer them all. We may not do it tonight. So let's start. We'll take a few questions and that'll be it. Hi, Lori.
Hi, how you doing?
Good.
Good. Thanks for joining us. I have a question from Penny. I would like to know what your thoughts are on when you want to change but your partner doesn't.
Well, first of all, Penny, once you have made the changes that you need to make, and you will become the light for your partner. Whether you want to believe it or not, men are scaredy pants. Women are the Braveheart heroes. Women have intuition still. Women will actually take chances. Men will take chances with money, but they will not take chances with their hearts. Their hearts are encrusted with a layer of scar tissue. All right? Our egos are too big. We don't want to be wrong. And that's the problem. I'm wrong 100 times a day. You know, the bigger you live, the more mistakes you'll make, and mistakes are beautiful. You'll never stop making mistakes because you'll never stop growing. Here's the test. He doesn't really believe you, Penny. So you need to bring out the Braveheart warrior within you, and you need to forge a path, and you need to show him that you're going there anyway, and that you don't need him to go to where you need to get to love you totally. Because Penny, how's it been working for you, filling your gas tank with everybody else's love? As soon as you fill up your gas tank with love, you will love everybody totally. There'll be no more love ransom. And that's the game here. I'm not talking about loving yourself so you don't love anybody else. I'm telling you, when you totally love yourself, you'll love everybody totally. That's how it works. Okay, I could tell you a little bit more, but, you know, just be the light for the family, because it's usually the woman that's going to be that. So, all right. And the other thing is men go like this. Well, how much is it going to cost, honey? You know, because everybody has a value, and most people have no value. So that means it better not cost anything. Okay.
Yeah. Okay, I have another question from Penny as well. Can any of what you were talking about fix sleep apnea?
Well, first of all, sleep apnea, people don't want to look at it for what it really is, but most people will have nightmares because they have fears. Most people, when they go to bed, sleep apnea, they go to bed and they go through all the things that they couldn't fix that day, all the things that they need to fix tomorrow. And then the other thing is, if you are eating soy, wheat, corn, dairy, well, then you're always going to have sleep apnea. Okay, the next thing is until you get and cleanse out your bowels, you have tons of inflammation. So you're going to create scar tissue. And when you create scar tissue and inflammation, your body makes tons of mucus. And these are caves. And these caves get all kinds of scar tissue and mucus in them. Simon, that was just up here, I broke up, I don't know if you saw it, but do you have makeup on? No. No. Anyway, Simon, come here. So see here, if you take a look, okay, you see how this is a little bit darker here? Well, he had what they call a deviated septum, but it actually, how's your breathing now since I worked on this? Clear. So he never had clear breathing, and I went in here and there was a calcium deposit with scar tissue in here. So I broke that up, and so now his breathing's better. So of course he's going to sleep better. Thanks. Mm-hmm. So anybody that's got mucus congestion and blocked breathing is going to snore, wake themselves up, and they're going to you know, because when you're doing that, you're actually swallowing your own spit because it's inflammation. Okay, you're going to choking yourself to death. All right, so there's more to it. There's diet, there's emotions. It's the same story all the time. It's like, does this guy only know that? I don't know. So, you know, all I can say, Penny, is guess what? We're kind of really, people are only living to not even 1% of their potential. Okay, and that's because they bought into the story outside. All right.
Thanks, Penny. I have a question from Robin. Love this new feature of DocStar TV. Way to go. What do you think of enemas, coffee or garlic? And are they necessary, or should she just drink the tea?
Okay, right off the bat, if you can embrace a coffee enema, then I say go ahead and do it. There, for every one person, there's 10 that will never do it. And they're really invigorating, coffee enemas. And you remember, the garlic and the coffee are two different things, though. And you could actually put the garlic into the coffee, but I wouldn't do it if it was your first time, because that would be overstimulating. Now, the coffee is mainly for purging the liver, for those of you who are on the air right now. And the coffee enemas are amazing, because actually, you know what? I like to have a coffee a day, but actually, in reality, coffee should be going in the other end, because that's his therapy part. Now, for me to go in this end, I just said to myself, this is the only addiction that I think I have, so I'm not giving it up. I got to hold that onto that one addiction, because and then it allows me to talk to people better. No, I'm kidding. So as far as the garlic goes, you could do a garlic enema, but you could do a wheatgrass juice enema. Oh, you could do you could use sometimes essential oils to do an enema, but always checks things out. And if it's your first time doing things, gentle baby steps are always the way to go. And the one thing that I will say is this: do the daily cleansing tea each and every day of your life. You know what? People say, well, I'm not going to do the tea because it's going to make me reliant on it. Well, that's not true. It does not make you reliant. I tell you what it does do. We live in very toxic times now. We live in an age of anxiety and conflict. And, there's a lot of stress that goes on in our abdomen. And don't tell me that everybody's got a great diet, because, I can only go to 2 places in this town. One place is White Spot, and order a quinoa salad. Or I can go to the health food store and take some soup home, or a couple of their bean salads. So listen, take the tea, because I know you're going to be starving out there, and you're going to get the best that you can, but it's still not that good, because corporations rule. Okay?
Doesn't make you reliant, it makes you regular.
That's it. And it also, guess what? You want to lose weight. You want to lose water retention. You don't want to age so fast. You don't want to have stiff joints. You don't want to have varicose veins. I can go on and on and on. Give me a symptom and I'll tell you it's all part of it, because guess what? Your good bacteria are the holy grail of your whole immune system. So, and they're in your large intestine. And the tea cleans the large intestine, the lymph, the blood, the liver and the kidneys and the bladder. So.
Thanks, Robin. I have a question from Katie. Hi, regarding the muscles being stiff and tight from exercise, do you recommend myofascial techniques like foam rolling for muscles, or massages?
Well, I don't recommend massages, because that only lasts for a few hours. It has to be actually a type of deep tissue that we do. Because if you're not, see, what happens is the reason why you're tight is because you overworked your muscles, right? So when you're younger, go ahead and do that, because you have better circulation now. But if you're older and you keep having soreness after your workouts, then these muscle fibers, instead of being like this, where the blood flow and the lymph is coming in, you've jammed those suckers up, and now you've even clumped them up like this. So foam rolling's amazing, do it. Core twisting's amazing, do it. Okay? But the thing is that if you're really sore from workouts, it's not a really smart thing if you're over the age of 35, 40, because you're only going to be really knotting up. And you know what? It's like this. The older you get, the more toxic you become, the less efficient you are. Well, that's with the average person out there, not me. So I'm not saying that. So with the majority. And the other thing is those belief systems that are making you misbehave and not like yourself and abuse yourself, they're even getting more entrenched as you get older. If by the time you're 50, you haven't started to wake up to the fact that you are a light being, an energy being, that you need love and love's the answer, then you're going down like a rocket that just lost its engine. Okay.
Mm-hmm. Thanks, Katie. Question from Purple. Please explain how deep tissue therapy helps with degenerative joint disease. Since the joint is already deteriorating, I understand it would remove scar tissue, but would it build up again since the joints are rubbing?
So anyways, do you believe that you are a self-healing machine? If you go to and you go through the medical system, there's a good chance you don't. If you believe in nature and if you believe in yourself, then you know that everything can heal. You know that osteoporosis can be reversed. You know that the cartilage between the bones of the skeletal system can be actually grow back. It's all about circulation. Now, if I were to go in and remove the scar tissue, would that increase the blood flow, which would increase the absorption of the calcium? And then if you took vitamin K2 and also if you took extra magnesium, we got to clean out your colon and we got you drinking structured water, we could reverse this thing. And I'll tell you something, if I can't help you reverse it to the point that it's not a problem for you and not creating pain, then I'll give back your money. So I could stand here all day and try to come up against the majority belief that we aren't self-healing and that we don't have the ability to turn things around like this. But why do that? I just have to offer a money-back guarantee because people love to challenge me on that. So
There we have it. Okay, I have a question from Nan. How can you work on someone with pituitary edema or scar tissue besides dietary and emotional work?
well, I would use energy medicine for that. You know, I would use things like Biotron Light to do that. I would use the Beefy to do that. But it's all about circulation. Even if it is the pituitary, we can still reach it. Does the pituitary get blood flow? Absolutely. Okay. But we can do other things to stimulate the pituitary. All right.
And I think that's it. No
Okay.
more questions.
All right. Very good. I want to thank everybody for joining us. This is why we're here. This is why we do it. And we love doing it for you. And just know that you're worth loving. Have a beautiful day. And just know this, we are doing another webinar. And that webinar is Issues in Your Tissues. And that's on June the 28th. All right. At 4 o'clock. And if you'd like to join us, we're going to show you how we kind of tie ourselves up in knots and how we can unwind that. Okay? Have a beautiful night. And if you like us, please share this video with other people. Share the information with other people. And just know that when you call, we're going to stay on the phone with you. We're going to answer your questions because you matter. Have a beautiful night.
Thanks, everybody.